Hi, welcome to another episode of Healthcare Homeopathy. Myself, Dr. Nitin, and today we have our guest speaker, Dr. Ashutosh. And today we'll be talking about thyroid. Thyroid is a very common problem which people are facing in today's time period. They come up with some or other complaints which are directly or indirectly related to thyroid. And thyroid is a very chronic condition and it has a long-term impact on your health. So we'll be getting some knowledge and some guidance from Dr. Ashutosh and how we can manage those conditions related to thyroid in an effective manner. Hi, Dr. Ashutosh. Welcome to the show.
Thank you. Thank you so much,
Yeah,
for calling me.
yeah. So, Dr. Ashutosh, our audience wants to know what is the thyroid gland and what is the role of thyroid in our body. Can you show some light on this?
Sure. So thyroid, we in our body we have certain glands. Thyroid is one amongst them, which is situated in the neck region near the throat, and it produces and secretes hormones. There are two main hormones it produces: T3, triiodothyroxine, then thyronin, or T4, generally we call it as. And it is very, very important in our normal growth, development, healthy muscles, blood cells, and development of our body tissue. So we require thyroid hormones for our proper functioning, daily activities. So it is very important hormone in our body. We call it as a master hormone also. Master gland. Thyroid gland is also called as master gland.
Okay, okay. Like, what is the role of thyroid in our body, and what all functions are performed by the thyroid gland?
So if thyroid is working properly, growth will be normal, bone development will be normal, mental development will be normal, okay, heartbeat and everything will be in normal range. When thyroid functioning abnormally, all those things, including metabolism, will go wrong. So there are mainly two types of condition when thyroid is not working properly. But one is the hyperthyroidism, when there is excess production of thyroid hormone in our body. One is hypothyroidism, where there is a low production of thyroid hormone in our body. In both the conditions, there are variety of symptoms. So we have to classify it into two parts, one which is having because of the hypothyroidism, and one which is having because of the hyperthyroidism. So these are the main things the thyroid controls.
Okay. So, we always hear that when patient visits to the clinic, and usually they have this question, like, doctor, why I'm getting this thyroid problem? I am following good healthy diet and all those things. I'm living healthy lifestyle, but still some patient keep on asking why I'm getting this thyroid problem. So, can you tell us what are the common causes of thyroid related problems and which are the people who commonly get affected by this kind of thyroid related problems?
This also I will classify into two types: the cause for hypothyroidism and the cause for hyperthyroidism. So the main causes for hypothyroidism will be further subdivided into these things. Like, one condition is called as thyroiditis. There is an inflammation of the thyroid gland. There also the thyroid production will be less from the thyroid gland. Then there is a condition called Hashimoto thyroiditis. Hashimoto thyroiditis is an autoimmune condition where body's own cells damages the thyroid gland. Then there will be some conditions like patients are taking this one medication after a surgery, like they have done surgery of thyroid, like thyroidectomy. Then there will be lesser production of thyroid hormone. Then there are certain autoimmune other conditions associated with this, like pernicious anemia, Sjogren syndrome, and other rheumatoid arthritis. So people are having more prone to this autoimmune disease. There are likely more chances that they will develop the hypothyroidism. Then there will be deficiency of thyroid hormone because of the iodine deficiency. This is also very common in certain part of world. So these are the main causes for hypothyroidism. Then comes the hyperthyroidism, why there is excess production of thyroid hormone. So there are mainly causes of Graves' disease, that is also called as diffuse toxic goiter. In this condition, the thyroid will be behaving abnormally, and there is excessive production of hormone, thyroid hormone in our body. So another condition, another condition is called as diffuse this multinodular goiter. There will be a nodule formation in the thyroid gland. It will produce excess number of thyroid hormone in our body. Then there again, the thyroiditis can cause overproduction also, less production also. In thyroiditis, sometimes what happens, there is excessive production of this thyroid hormone in our body. That is also one cause. Then some people, by mistake, also take excess of iodine also, like in some medicines form, some are the other forms. That can also lead to this one. Even some patients in hypothyroidism having this problem since birth also. That can also lead to their problem in development, mental as well as physical. Okay, and some patients are like in these areas. There are more common like this thyroid problem. There is some family history of thyroid problem in the family. Female, particularly more than 60 years, are more prone to develop the thyroid conditions. So these are the main causes for this thyroid problem in our clinical findings. What we see. Even stress also play a role. Nowadays, you see how the stress is going on. It is also a predisposing factor for thyroid. Yes.
Thank you, Dr. Ashutosh. I think our audience must have got some clarity why there is this thyroid conditions are happening so commonly and what are the common causes. So when the people visit to the clinic, they come up with certain symptoms and they like confuse various symptoms with some other conditions which are maybe not related to thyroid. So can you guide us on what are the common symptoms of hypothyroidism and hyperthyroidism? And is it common in child? Is it common in adults? Whether it is common in male or female? Can you guide us on this point?
As you said that it is very difficult to diagnose because it is more sometimes what happens in pregnancy also female gets similar kind of symptoms. Patients who are aging also they also develop similar kind of symptoms. So it is little bit difficult in these cases to differentially diagnose. And regarding the symptom parts and signs part, again it will be divided into two: those which are occurring because of the hypothyroidism, those which are occurring because of the hyperthyroidism. So for hypothyroidism, somebody is having less production of thyroid hormone in their body. That is called hypothyroidism. Symptoms would be like tiredness, getting weight. Even though the patient is eating normally, but they are getting weight, lethargy, no desire to work at all, coarse hair fall, thickness will be there, hair thickness will be there, voice will be hoarse, and periods in females especially, the menses are very much frequent and heavy will be there. So these are the symptoms for hypothyroidism. And regarding the hyperthyroidism part, there will be excessive sensitivity to heat. Patient will say, "Oh, I'm feeling very heat every time." And but although the weather is normal, but he will feel the sensation of heat in his body. There will be tremor in their hands and this one muscles and all. Excessive weight loss in spite of patient eating full meals. They have been having weight loss sensation and excessive sometimes diarrhea also will be there. Unknown cause because of that. And more commonly in hyperthyroidism, you will see that there is a goiter, there is swelling in the thyroid gland, which is called goiter. It is also very common in hyperthyroidism. And in some cases, there is bulging of eye, exophthalmos. It is also common in Graves' disease. So these are the main symptoms. And hyperthyroidism, just opposite to hypothyroidism, the menses will be absent in some cases or very, very less, scanty. So in females. So these are the basic symptoms we come across in our general practice in thyroid problem.
Okay, thank you, doctor. So, as you correctly said, it's a master gland of the body and it has symptoms or it has effect right from head to toe, and it also has different presentation or different symptoms in men and women. So, it's requested to the audience that they just don't do self-diagnosis. You should visit and consult the doctor to get the actual accurate diagnosis of your symptoms instead of just doing self-diagnosis and self-treatment. So, doctor, when such kind of people or patients visit to you, how you proceed with diagnosing and doing some test for diagnosis of this kind of patients?
First, we will look out the symptoms as explained earlier. The symptoms will be there. So we will make up all those symptoms in at once. What are the symptoms and signs these patients are having? That will also give us a hint that this patient might be suffering from hypo or hyperthyroidism. Then if we want to rule out again, we can do physical examination. In cases of goiter, exophthalmos, it is quite clear that patient is bulging of the eyelids. So this will also indicate to an extent that this patient might be having a thyroid problem. If we want to further dig it out and to rule out, then mainly tests will be like TSH, that is called thyroid stimulating hormone, that is produced from pituitary gland to regulate the thyroid production in our body. In cases of hypothyroidism, generally we see that TSH level are elevated. So that is one quite evident that TSH is more, the thyroid problem is in hypothyroidism, and opposite and vice versa in hyperthyroidism. The TSH level will be normal or it will be low. Then comes the, if at all it is not possible, then we take T4, that is thyronin. In cases of low hypothyroidism, that T4 will be also be less. In case of hyperthyroidism, T4 will be more. Same thing with T3. If T3 is, but T3 is more of like hyperthyroidism, it is more evident. T3 is more in hyperthyroidism, but lesser in the hypothyroidism, but more in the hyperthyroidism, it will be more only. So these are the basic tests. Then if you want to further rule out, further be more specific, then we can do free T3 test, free T4 test. These are all advanced tests. Then in condition like Hashimoto thyroiditis or an autoimmune condition, we can do tests like anti-thyroid antibody. It is also quite evident. And if at all those things are not there, we can do thyroglobulin test. Then we can do calcitonin also in some cases. So these are the basic tests we can do. And we can take help of imaging also, like CT scan or ultrasonography. If we see some kind of growth is there, so that in ultrasonography we can see the size, shape, and formation of needles in the thyroid gland, whether it is there or not. So this we can think, we can rule it out from other diseases, the thyroid problem.
Okay. So, doctor, when you diagnose this kind of patient, then what kind of, like, people usually have choices between choosing the medical treatment, taking some medicine, and going for some kind of surgeries in some cases. But as in your practice, what do you think? What are the choices available for this kind of patients?
I will tell about the conventional part also, what actually conventional what they do. So in case of hyperthyroidism or hypothyroidism, what their approach is to bring back the thyroid level to normal. So this is their main approach, to bring back the thyroid level to the normal. They are not concerned about the functioning of thyroid gland. Their main thing is like thyroid level should be normal in our body. So in case of hyperthyroidism, if they found something like they will remove thyroid, they will remove the thyroid gland. It's called a surgery, thyroidectomy. They will give some anti-thyroid drugs to that so that the thyroid should not produce over excess of thyroid hormone. Even they will give radioactive iodine to destroy some part of thyroid cells so that it will not produce an all. And in case of hypothyroidism, there will be mainly the thyroid replacement therapy. And commonly used medicine is levothyroxine. That what they will. This is a man-made medicine, chemical medicines, that hormone that we give to the patient who is in hypothyroidism to just replace the lost thyroid hormone in our body. So this they will give as long as it is there. Even in thyroidectomy also, the part of thyroid is removed, so patient will have to continue the thyroid treatment for a long time. In our homeopathic approach, we first want to see what is the cause for this thyroid problem. What is the internal problem happened which has led to this cause? And our approach should be like we will take the complete signs, symptoms, patient age, gender, whatever they are doing, whatever their personal history, whatever their mental and physical attitude, how they behave. We sum up all those symptoms and we have an individualistic approach for each and every patient. We are not giving same medicine like thyroxine or something to each and every patient. Our approach is to correct the internal imbalance and correct the internal problem in thyroid gland, so that if the patient is succeeded, if the results are good, if it is succeeded, then we can say that we can get rid of life from taking medicine for thyroid. It is quite possible with homeopathy. So this is the main approach we have in our homeopathy.
Okay. So, doctor, you have been practicing classical homeopathy for last more than 12 years. So, can you help us with like the role of homeopathy in thyroid related problems? and how, like, if somebody wants to get in touch with you for their thyroid related problems, how they can reach to you and how they can contact you for further treatment.
Yeah, I will just say this thing, like if somebody is already taking the thyroid tablets, so what we do, we generally, if patient comes, we take case history and all, and we generally don't at once tell to stop the thyroid medication. We will taper the dose over a period of time. Oh, and prognosis wise also, if patient is having thyroid recently, it is very, very good that they can come and take homeopathic medicines. And the prognosis will also be, prognosis means outcome will be very, very good in those cases. If patient is having thyroid for years, years and years, they are suffering, it will take some time. We will gradually taper the dose, like 100 mg, will keep on 50, 25, 12.5. Then they can come to our homeopathic medicines and will try for the cure. So these are our basic approach in homeopathy along with the conventional treatment. If somebody is sick, and the patient wants to come, they can come and visit my clinic, that is Healthcare Homeopathy in MCC B Block, Davangere, Mamas Road, along with their previous prescriptions, report, scan if they have any, or else if they want, they can come also. Directly they can consult me. If I feel if something is required, I will also prescribe them. Then we can start the treatment. There will be regular follow-up with me. And over a period of time, we have seen cases where patients are taking 50 mcg thyroid tablets, 75 mcg. They are also cured in a long period of time. So this is our approach in homeopathy. But patient has to be take treatment regularly. They should be follow our guidelines, like following diet charts. We do diet chart also along with synthetic medicine, some de-stressing activity, because stress is also a factor in thyroid in some role. So we will advise all those things in our clinic.
Okay. Thank you, doctor. Thank you for guiding us on various aspects of thyroid conditions and how to manage those conditions, how to diagnose them. So it has been very insightful and very helpful topic today. We hope to connect with you with another topic, another health condition, which can help the people to be aware about their health conditions and the symptoms that they are facing. So that's all for today. Thank you very much. If you are new to this channel, please do subscribe to this channel. And if you like this video, please share with your family member or somebody in your family who is suffering from thyroid related problems. By sharing this video with them, you are helping them to manage their health condition in a very optimal and natural way. So that's all for. We'll meet again in next episode. Till then, bye bye. Thank you very much. Thank you, Dr. Ashutosh.